Thank you, Secretary General. Thank you for your inspiring words and for your leadership. Allow me now to introduce His Excellency Ambassador Caleb Otto of Palau, who is the chair of the Friends of Mental Health and who leads the debate here also within these walls on this very, very important issue. I would like to ask him to deliver his remarks on International Youth Day. Sir, Excellency, you have the floor.
Thank you very much, Assistant Secretary Mr. Gass, Secretary General, Special Envoy, distinguished members of the panels, Excellencies, ladies and gentlemen. It is a great honor for me to be here and to speak on this topic that is very, very close to my heart. And very soon I will let you know why. But I want to congratulate all of you for taking your time to come, and especially for the young people who are here, because it's really the time for us to get together and move on this very important health issue throughout the world. Thank you very much to the organizers for organizing this meeting, and thank you very much, the Special Envoy, for choosing this topic of mental health for this year's International Day for Youth. I come from Palau, which is a very, very small paradise island in the Pacific of 21,000 people. And because it's very small, we have one distinguished curse. And this is that we have a very high prevalence of schizophrenia, probably the highest in the world, because of inbreeding of this genetic disposition disorder. I want to say this from the start, that mental illness, when we talk about mental health and well-being, we're talking about everything from physically ill to psychologically disruptive behavior, the whole range of things. I say this is a curse in Palau because there are so many people who have succumbed to this disease of schizophrenia. But the silver lining, in my own family, I have lost 3 cousins, 2 from my mother's sister's family, and 1 from my mother's brother's family. So they're very close to me, and they all had schizophrenia. So my family could also be severely affected. But the silver lining in this situation in Palau is that we have learned, because of this disease, to deal with the stigma and the discrimination against mental illness. And that's the silver lining. Right now in Palau, the people with mental illness who are diagnosed in the hospital are very well accepted in the community. They don't have to be hospitalized. They can stay at home, and the public health nurses and public health people can go and see them at home and give them their medications. Unless they become severely ill and need to be hospitalized for acute care, they can stay at home, and the community has learned to accept them. That's the silver lining. What we have not learned to deal with as well in Palau is the other part of mental health issues. And these are the issues of young people who have to deal with problems at school. I was looking at the profile for young people from high school, the data that came last week to me for 2013. And it indicates that 17 to 20% of high school kids had lost at least 1 day of school in the past year because they were afraid to go to school. They were afraid they would be bullied, or they were afraid that the school environment was not safe for them because there was fighting and because there were weapons in the school ground. I also learned from the profile that 3% of all of our deaths in Palau are due to suicide. So in answer to the question that the young lady had asked before we started this program. We have seen an increase in suicide, especially among the young people, in the past couple of decades. We think that one of the reasons for this is because there has been a crash or a conflict between Western ideas, Western values, and the traditional practices and traditional values. And our families have not learned very well to deal with them. The young people have not learned very well to deal with them. So we think that the way to deal with the problems of mental illness with the young people is actually to do more research, to put more investment into the prevention areas, to try and see how we can prepare the families to be more effective in guiding and in helping their children to deal with the pressures of life, and to help the teachers, to help the students deal with the pressures of school. We think that it's important for the whole community, the faith community, and all the various members of the community to be particularly aware of the young people's pressures, pressures of school, pressures of unemployment, pressures of dealing with their peers. Sometimes they have to deal with the pressure of having to try tobacco, or having to try alcohol, or having to try other drugs. These are all the pressures that the young people have to deal with. I remember particularly one day when I had a focus group on young people to ask them, what are some of the most important issues that you have? And one 7th grade told me that they would really like to have their parents spend more time with them. He said, we believe that our parents try to buy us with toys and good food, and they give us all of these things while they go and do other things. So in conclusion, I just want to say that I think for all of us, in order to deal with these problems of suicide, problems of mental illness, the whole range from biochemical disorders to the psychological and behavioral disorders, we have to try to get at the root of the problems. I was reading an article about mental health services in Australia, and they said that they spent close to $29 billion in treating mental illnesses. And we think that we can gain more if we spend more in preventing them, because once we spend the $25 billion in treating, we've already lost in economic cost from lost productive days of work, and lost in terms of psychological and family relationships. So congratulations to the United Nations for organizing this meeting. Congratulations to you, the envoy, for electing this topic for this year. And thank you very much. I want to pay a special tribute to Dr. Judy and Joe, the team from the Friends of Mental Health and Well-Being, for their insistence in helping us to work in making sure that the mental health and well-being was well established in the Sustainable Development Goals that we had just worked on. I just want to end by quoting from our Secretary General last year when he spoke about mental illness, and he said the United Nations wants to help lift the veil that keeps the young people locked in a chamber of isolation, of silence. So we want to look at those videos, and one of the videos kept saying, speak your mind, speak your mind, speak your mind. I recall from looking at the on television about Robin Williams' suicide yesterday, and he said that he was not afraid to talk about